Hello class. So today we are obviously talking about our patient's results from our previous assignment. So here's my clinical test presentation. We are starting with patient history. So let's go back and go over the patient history. It's a 25-year-old African-American female. Her height is 5 feet and 2 inches. She weighs 120 pounds, and she comes in complaining of tiredness and increased urination. She also presents with swelling of the legs and the feet, and her blood pressure at the time of intake is 185/95, indicating clear hypertension. So, based on those symptoms, my initial diagnosis was diabetes based on her fatigue, increased urination, and the swelling of the legs and the feet indicate a kidney complication in diabetes called diabetic nephropathy. Sorry if I butchered that. I'm still learning the pronunciation with everything. But yeah, again, she has increased urination, hypertension, fatigue, all indicates symptoms of diabetes, or so I thought, but let's go over the test results for glucose determination. So we did 3 tests. We did the glucose meter, the Benedict's reagent test, and the glucose reagent strip. The glucose meter is a blood sample test in which you take the test strip and you take a sample of the blood, then it's placed on the strip, then placed into the meter. When the oxygen is present, the blood glucose oxidase and glucose combine to form hydrogen peroxide and gluconic acid. And then the meter sends a voltage into the test strip, which oxidizes the hydrogen peroxide, and then that will give us the meter will translate that into a concentration in which we can read, which will be in milligrams per deciliter. For our patient here, the results were 120 milligrams per deciliter, which is a little on the abnormal side. It does indicate that it is abnormally high, especially because both of the other tests also indicate high glucose. So for the Benedict's reagent test, this is a urine sample. It just takes a sample of the patient's urine, again placed on the designated area of the test strip, and based on the levels of glucose in the patient's urine, it will change to different colors. In our patient's case, it did turn green, and a green color indicates about 500 milligrams per deciliter glucose in our patient's urine, which again is a little abnormally high. And once again, for the glucose reagent strip, same thing, the color turned an olive green color, once again indicating 500 milligrams per deciliter of glucose in the patient's urine. So overall, the glucose, her glucose levels are abnormally high, which indicate, again, either diabetes or leaning maybe towards kidney failure or kidney disease as well. Moving on to the enzyme kinetics, we ran 2 tests. Creatine kinase results came out normal, which is good, because Unusual blood levels of creatine kinase usually indicate tissue injury because it's usually only found inside the cells of muscles and organs. So again, the results were normal, which is good. Her lactate dehydrogenase results were normal as well, which again is good. And sorry, here I'm looking through my presentation. The graph is showing us that over time, the more time, the more creatine and lactate dehydrogenase absorbance we have, and then you can look more into that on my presentation. Moving on to our urinalysis results. So her initial urine sample is a medium yellow color, which is a normal color, which again is good. Multiple tests were run in her urinalysis. So test 1 is the protein test. Her results came out abnormal, indicating that the protein was present in her urine sample. And this was shown by the precipitate being formed in the test. For the protein being in her urine, this indicates a disorder that can be brought on by either renal disease or kidney injury, which again puts me more towards the side of kidney disease for this patient instead of my initial diagnosis for diabetes. Then moving on for test 2, we did a specific gravity and pH test. Her pH was normal, and her specific gravity was actually abnormally low. So this can be caused by diabetes, this could be caused by kidney failure, kidney disease, excessive fluid intake. Let's see here. Yeah, so her, again, specific gravity was abnormally low, so points me into the direction of kidney failure once again, which is not very good for this patient. For test 3, we did an electrolyte panel, and all her results were normal for this, which is good because high levels of calcium in the urine may be a sign of hyperglycemia and parathyroid gland dysfunction. And then high potassium levels could indicate cardiac arrest or hyperglycemia. Yeah, that is good. All her tests for that were normal. Moving on to the ketone test. Her results for the ketone test were negative, and a negative for bilirubin. I'm sorry if I'm butchering that once again. This is good because ketones are usually completely broken down by the body. And usually they are only found in urine samples from people who follow low-carb diets or cannot use carbs as an energy source. They can present in the body as a result of various situations, including continuous vomiting, malnutrition, and diabetes. So this pushed me away from my diagnosis of diabetes because, again, she was negative for ketones. Our last test was the reagent test, and her results were normal, so she has none in her urine. The color remained yellow orange. It did not turn pink. If it were to turn pink, it would have indicated increased levels of urobilinogen, and this is seen in patients with liver illness or liver injury. This can also be seen in increased urine urobilin levels. Can also be a result of diseases such as hemolytic anemia. I'm so sorry, I'm butchering a lot of these names. I need to do better. Which speed up the body's destruction of red blood cells. Anyways, this is good that it was normal for her. Overall, in light of these test results, including the patient's symptoms, again, she was feeling fatigue, increased urination, swelling of the legs and the feet. She had hypertension. I came to the conclusion of a different diagnosis, being kidney disease, with particular emphasis on the potential for diabetic nephropathy, given that the patient's normal blood glucose levels, but she has abnormal urine results, and again, she has the swelling of the legs and the feet. My patient's treatment plan, I would center it around controlling blood pressure and glucose levels, to lessen the burden on the kidneys and control edema. We would definitely have to make some lifestyle changes, such as eating a low protein, low sodium diet, exercising more frequently, and keeping an eye on how much fluid is consumed, in addition to routine monitoring of like renal function, blood pressure, once again, blood glucose levels. We could also do medication to manage blood pressure and blood sugar levels. We could definitely administer that for her. And then a referral to a nephrologist for additional assessment and care could be definitely taken into consideration if her symptoms do continue to get worse. And that is it for our patient's findings for today. Thank you, and thank you for bearing with me. It's been a long day, so sorry for the mess ups in all the pronunciation. Have a great night.